So today I'm going to be showing you how to insert a Foley catheter into Mrs. Smith over here. So the first thing that we'll be needing is obviously the Foley catheter. For females, it's ideal to use around 12 to 14 French. So in this case, I'm going to be using the 14, this is the 12 French. In addition, you'll be needing sterile gloves because this is a sterile technique, and a blue pad as well as a catheter insertion kit. So we have here forceps, we have alcohol swabs, lube, an under pad and a fenestrated pad, drape, and a waste bag. Okay. So to begin with, I'm going to just prepare the patient. So in this case, I would just put the blue pad underneath the patient. Of course, I need to do hand hygiene. And I also have, I didn't mention, I also have a urine bag here that we're going to place in the bed frame, not the bed railing. And from there, we can just place it here and ask the patient to keep it still on their feet to keep the tip sterile, if I can do that. Okay. Once that's prepared, even before the procedure, if your patient is soiled, it's best to do peri-care before this whole procedure, just to make sure that their perineal area is clean. And then now I'm just going to set up the sterile field. So maintaining that 2-inch border. I'm just going to take everything out of the kit. So I have a garbage bag. We have the under drape and the the under pad and the fenestrated drape. Smooth this. I have my 10cc syringe to fill up the balloon, and we have here alcohol swabs. Let's take these all out. And the lube as well. So I'm just maintaining that sterile field. Now I prepared this, I can open up the Foley catheter, pretending that this isn't open already. So it's in a sterile packaging inside, so I'm just going to use my forceps to plop it onto this sterile field. And this can go in the garbage, which I will prepare it now. So once that's prepared, I can place my sterile gloves. If I had more space, that'd be better, but I'm just going to use this half of the table to put my sterile gloves on. So sterile gloves are on. Place this in the garbage. So now I'm going to test out the balloon. By doing this, I'm going to take the 10cc syringe. And we're going to test it just, well, depending on the facilities, because sometimes some facilities might not want you to test it out, but for in this case I will. So we're just testing it to see if there's any leakage. Right now the balloon it's good, it's not leaking. So now I'm just going to withdraw the fluid. Okay. Now I'm going to place the drape, the under pad underneath the patient. So to maintain sterility, I'm just going to fold the pad over my hand so it doesn't get contaminated by the patient's legs. Okay, Mrs. Smith, I'm going to insert this underneath, this pad underneath. And we're going to take the fenestrated drape and place it over the perineal area. So just exposing the Mrs. Smith's perineal area. So now I'm going to prepare my swab. So I have all my alcohol swabs here. And I'm going to lubricate the tip of the catheter just to prepare it. I'm just going to pretend it's lubricated. I'm going to bring this all to the patient, closest to the patient. And beforehand, we're going to cleanse the area. So I'm going to take these swabs. I'm going to take my non-dominant hand to spread the labia. So I'm going to spread the labia. And you're going to do clean to dirty technique. So I'm going to take one swab right in the center, garbage. One on the right side, one on the side, garbage, and one on the other side. Right? And depending on if the patient might have like signs of infection or whatnot, you can bring more swabs to the bedside to clean it properly. But in this case, Mrs. Smith doesn't really need to, so I just did 3. And now I'm going to take my catheter. And beforehand, you're just going to encourage the patient to take deep breaths as I insert the catheter inside. Okay, Mrs. Smith, I'm going to insert the catheter in you. I want you to take nice deep breaths as I insert it. And let me know if there's any pain. So I'm going to insert it right now. Ideally, you want to insert around 5 to 7.5 centimeters. Let's pretend that's around that measurement. And until you see urine coming out, you want to advance 2 centimeters. So just advance it 2 centimeters. Once that's there, I'm going to remove my non-dominant hand. I'm going to take my sterile hand and inflate the balloon with the 10 cc. Once that's there, you can give it a little tug just to make sure it's in place. So that's good that's intact in the bladder. I'm just going to remove this. And now I'm going to take the tubing of the urine bag. Tubing the urine bag. And then now I'm going to take the non-dominant hand to remove the cap and insert it to the port. And from here, you can tape the tubing to the leg of the patient. So I'm just going to use tape for this. And if needed, you can attach the tubing to a pin on the bed. And yeah, so now we can clean up. I can rip this fenestrated drape. And so right afterwards, you can just provide patient teaching, making sure that they don't lie on the tubing, making sure that the bag is not on the ground because it can contaminate it, and just to, inform the nurse if there's any irritation occurring when they're urinating. And yeah, and so normally right afterwards, you would document it either in the nursing notes or in the fluid balance sheet or in the tubes and drains sheet, and you can document about the size of the catheter you use, the ease of insertion, how many attempts you had, how much fluid that you inserted into the balloon, and also the characteristics of the urine. And yeah, and that's everything.